I would like to start by expressing my gratitude to the government of Japan for its ongoing leadership and for convening this important regional platform, which really helps us to keep the momentum and help us drive progress forward on this important AMR and One Health agenda. Over the last 2 days, all of us have heard inspiring examples of innovation and commitment, from, for example, enhanced surveillance systems to successful stewardship initiatives. Just thinking back to our last 2 days, a few more highlights perhaps. Aspire, the Asia-Pacific One Health initiative on AMR, has demonstrated the power of Asia-Pacific collaboration across its 30 countries. Through its 4 working groups, Aspire has translated dialogue into very concrete action. One notable example is the capacity building support for AMR outbreak response in hospitals, which really has been led or enabled by one of our WHO collaborating centers in Japan. Another key milestone, I would say, for this year is the consolidation of progress data from the 28 Asia-Pacific countries into the first scientific manuscript this year, which really underscores the conference's role in driving measurable action and evidence-based progress on AMR. FAO has strengthened Reno-Farm and is thereby reducing the need for antimicrobials and more sustainable agri-foods. And the World Organization for Animal Health has introduced Animuse to monitor antimicrobial use in animals. We at WHO here in the Sierra region, Southeast Asia region, have coordinated our member states' endorsement of the regional roadmap on AMR and the adoption of regional resolution for acceleration action on AMR in the human health sector. So, all these are very tangible achievements in the lead up or at the Tokyo conference. It is now, I feel, incumbent upon all of us to make sure that these commitments are carried out into national policies, budgets, and our concrete work on the ground. As WHO Sierra, we stand ready and will continue to support and provide technical support to countries, especially to strengthen national AMR surveillance systems, integrate AMR interventions into primary health care and the broader health system strategies, scaling up infection and control initiatives, and ensure, importantly, equitable access, appropriate use, and disposal of antimicrobials. We will also continue to advocate for the inclusion of antimicrobial resistance priorities in national policies and national budgets, which we feel is absolutely critical. By maintaining ongoing dialogue and sharing best practices across the region, WHO aims to empower countries to achieve sustainable and measurable progress in combating antimicrobial resistance. The key word here for me from this conference is collaboration and cooperation for tangible progress. Together, we have the power to change the trajectory of AMR and safeguard the health of future generations.